Hello. Welcome to the Woodrow Wilson School. I'm Elizabeth Donahue. I run Public and External Affairs here at the school, and I'm very pleased to have you all here for today's talk, Keeping Politics Out of Women's Health, with Cecile Richards, who's the president of Planned Parenthood. Ms. Richards is visiting the Wilson School as part of our Leadership and Governance program, where we bring in leaders who are exemplary to work with our students over a 2-day period, and it's been a really amazing visit thus far. Today's talk is also co-sponsored by two of our centers, the Office of Population Research, which does a lot of work on fertility and demography issues, as well as the Center for Health and Wellbeing. Before we get started, I just wanted to go over a few of the ground rules today. As you can see, we have two cameras here, and C-SPAN is taping this, and so thank you, C-SPAN, for taping this. But it really is important to make sure your cell phones are off and there's not a lot of any whispering or talking during the talk, because the sound system is very sensitive. Today, Ms. Richards is going to talk, and then we're going to have a Q&A. There's two standing mics here. As is always the case in our 4:30 talks, we do preference students. So I ask students, come down, don't be shy, ask your questions first, and if there's time, then we, of course, welcome community members to ask their questions. We do ask, we've had sort of an issue lately of people leaving during the Q&A, which is really disruptive because it's a lot of noise, especially with the cameras here. So if you feel that you need to leave before 6 o'clock, when this will all end, I ask you to leave at the end of the talk, but before the Q&A starts. We would really appreciate that. As is always, please keep your questions, which means there's a question mark at the end, and short, and please be respectful. We all have differences of opinions, and so I ask that we adhere to that, as we always do at Princeton. Finally, I'd ask at the end of the talk, please stay in your seats while our speakers leave. And so, without going into any more housekeeping, I'd like to introduce our introducer of Cecile Richards, Janet Currie. Janet Currie is the Henry Putman Professor of Economics and Public Affairs at Princeton University. She's the director of the Center for Health and Wellbeing, and we're so pleased she can do the introduction and put this talk in context. Thanks.
Oh, I have to say I'm honored to have the opportunity to introduce Cecile Richards. She has served as the head of Planned Parenthood since 2006. Every year, through nearly 800 centers nationwide, this 95-year-old organization provides family planning, reproductive, and sexual health care services to nearly 3 million people. During her tenure, Ms. Richards has expanded the organization's advocacy for access to health care. She has led a nationwide campaign to preserve access to Planned Parenthood's preventive care through federal programs. She started the Youth Initiatives program that trains young people each year in leadership skills and healthcare advocacy. She's invested in Planned Parenthood Online, a website that provides mobile access to health information and is visited by 33 million visitors every year. Under her leadership, the number of Planned Parenthood supporters has doubled, reaching a total of more than 6 million people. Before joining Planned Parenthood, Richards served as the Deputy Chief of Staff for House Democratic leader Nancy Pelosi. In 2004, she founded and served as president of America Votes, a coalition of 42 national grassroots organizations working to maximize registration, education, and voter participation. In 2011, Richards was named to Times Magazine's annual list of the 100 most influential people in the world. So we're very privileged to have her here. She has also been recognized as a national leader by the National Council of Jewish Women, U.S. Action, and the Puffin Nation Prize for Creative Citizenship. She's a 1980 grad of Brown University, and in 2010 she received an honorary doctorate from Brown. She also serves, in her spare time, on the board of the Ford Foundation. So today's talk, Keeping Politics Out of Women's Health, is being presented at a critical moment in a nationwide conversation about women's health. The public outcry after the Susan B. Komen withdrawal and then reinstatement of funding to Planned Parenthood for breast cancer screening, the debate in Washington about contraception and religious organizations, whether they can be obligated to provide health insurance coverage, and even this week's Supreme Court hearing on the Affordable Care Act have brought stark attention to the question about what the appropriate role is for government and for nonprofit organizations and for insurance companies in promoting women's health. Of course, for many of us who study or advocate on behalf of these issues, or for those of us who just care about these issues, questions about ensuring women's access to health care are not new ones. Researchers at the Center for Health and Wellbeing and the Office of Population Research have focused on the importance of access to reproductive health around the world. Worldwide, an estimated 358,000 women die from pregnancy-related causes each year. Princeton scholars like Ann Case and Christina Paxson have examined how access to health care in sub-Saharan Africa impacts that rate, while João Biel studies the processes that govern access to health care in Brazil. Though most of these maternal deaths occur in developing countries, the United States has one of the highest maternal mortality rates among developed countries, 1,000 maternal deaths per year. Among developed countries, the U.S. also has the highest incidence of low birth weight and infant death, something that is not unrelated to maternal health. CHW and OPR affiliate Betsy Armstrong studies policy approaches to improving the maternity care system. My own research has shown that extending public health insurance to poor women and children has improved infant health and reduced mortality, but clearly there's a long way to go, given that half of all U.S. pregnancies are unintended. Clearly, Planned Parenthood continues to fill a vital need. One of our newest affiliates at the Center for Health and Wellbeing, Thomas Fujiwara, has done research showing that political participation by disadvantaged citizens affects access to health care and infant health in Brazil. And when I was preparing these remarks, I couldn't help thinking about the different parts of Ms. Richards' career, looking at political participation and also access to health. It may be that the link between politics and women's health is inevitable, but Ms. Richards will speak to that. So please join me in giving her a warm welcome.
Thanks so much. Thank you. Okay, there's a lot of microphones, if I come at the press club. Thank you very much, Janet, for that really nice introduction. And it's wonderful to be with you this afternoon. It was great to be here all day with a lot of interesting students at the Woodrow Wilson School. And thanks to all the students and faculty who both hosted events and got me around campus. And so particularly Professors Stan Katz and Betsy Armstrong and Elizabeth Donahue, of course, for having me here. I also want to acknowledge Debbie D'Arcangelo, who is the interim CEO of Planned Parenthood of Mercer County, who's here today, and I know a lot of our Planned Parenthood supporters. So anyway, welcome to all of you. It's nice to be at Princeton. Before I get my formal remarks, I think since I don't know that much, you don't know that much about me, or I don't know that much about you, I'll just mention a couple of things. I was actually born in Texas, which has been I was born in Waco, Texas, even, which someone had to be, and. But my folks were actually both went to Baylor University, which, as you know, is a Baptist school, and they were high school sweethearts, and then they both went on to Baylor, and where my mother said everything they did was that much more fun because it was either against the rules or it was a sin. In fact, rumor has it that the Baptist Convention disallowed having sex standing up at Baylor because someone might think you were trying to dance, which of course was completely forbidden. I know, you get it now, right? Anyway, that was sort of my family upbringing, though. I think so. My folks, whether it was being at Baylor, that kind of made them, sort of tough. But our family was just one where every issue and every movement that came through town, they got involved in. I grew up in Dallas, where in the height of the civil rights movement, so they were involved in that. They were involved in the women's movement, the farm workers movement. Our dinner table wasn't where you ate; it's where you sorted whatever precinct list they were working on for the campaign they were involved in. But so it was really that's how I and my siblings were raised. We eventually moved to Austin, and my mother, she was a traditional housewife. I mean, she raised 4 kids, and it was the 50s and 60s after all. And but we moved to Austin in the height of the anti-war movement, so everything was kind of going crazy in Austin. And she was invited for the first time to actually run a campaign, which was unheard of for women in those days. And it was for a young woman who wanted to run for the state legislature. And women weren't running for office in those days either, so the whole thing it seemed a little bit cracked. But Mom said, what the heck? I've been volunteering for campaigns all these years, and so I think I'll give my hand at it. So, and all of us kids got to be involved. We were so excited, learning all those critical political skills you need for your lifetime, like handing out bumper stickers and stuffing envelopes and taking down yard signs. Anyway, the end of the story is it was a very tough race, very competitive, but this young woman won and went to the state legislature, and her name was Sarah Weddington. And many of you will remember, some of you are too young to remember, but Sarah, at the age of 26, argued the Roe versus Wade case before the United States Supreme Court. And of course has spent her entire life fighting for women's rights. And so I feel like in some ways my whole life has come full circle now, being at Planned Parenthood. Of course, the real moral of the story is that my mom then kind of got hooked on politics and thought it seemed like so much fun that she would run for office herself. And she did a series of times, was elected to a variety of offices. But there was one moment, even in the state of Texas, when sort of the stars and the moon and everything aligned, and we elected the first and only completely pro-choice woman governor of the state of Texas, my mom, Ann Richards. So thank you. I just think about, we all stand on the shoulders of those who came before us. And so I want to really give a special acknowledgement to Mom and all the women who, years ago, fought the battles so that we wouldn't have to fight them. And yet here we are, doing it all over again. Mom used to paraphrase that Edna St. Vincent Millay quote. So please, all of you who are actual scholars, don't look this up because it's not going to sound quite right. But it's something like, life isn't one thing after another. It's the same damn thing over and over again. And that kind of feels like what we're dealing with. So in any case, now I'll get into my serious remarks. And since this is Princeton University, I did prepare some remarks about a topic that I think is interesting. I hope you will too. I want to, though, acknowledge Chris Paxson, your fabulous what fabulous work she's done here at the Woodrow Wilson School, and how lucky Brown University is to steal her away, my alma mater. And I mention that because actually my first experience with Planned Parenthood was at Brown as a student. Because I needed birth control in college. And it was rather unthinkable to go to the campus, health center. And plus, Planned Parenthood was the only place I knew that really knew everything about birth control. And it's kind of funny because a lot has changed since I walked into that health center in Providence, Rhode Island years ago, but a lot of things haven't changed. And that's how millions of women actually first get birth control, is at Planned Parenthood. I'm sorry, I have a bit of a cold, so with apologies. Every day, hundreds of people, primarily young people, come to our health centers and ask the same thing. I need to get birth control, and I need it affordable. I don't have money to pay. Or I'm afraid I'm pregnant. Is there somebody that I can talk to? Or I need to get, I think I need testing for an STD. So Planned Parenthood was started 96 years ago by Margaret Sanger, a very quick history lesson here, in Brooklyn, New York, out of a concern that women, and particularly immigrant women in New York, were unable to get information about birth control, and certainly were unable to get any kind of birth control devices, and were unable to plan their families. Margaret, of course, was drawn to this work from seeing her own mother, who had died at the age of 50, after having 11 children and 7 miscarriages. Her her body literally wore out from so many pregnancies. And so that is really how Margaret got into the work. Of course, at the time, the Comstock Law prevented any distribution of birth control information or certainly of devices. And you read about the early days in which women, brought diaphragms over from Europe in their suitcases and then smuggled them through trains. And it wasn't until 1936 that the Comstock laws were rolled back, and they really weren't finally repealed until 1970, which for some of us does not seem that long ago. Of course, it wasn't until 1965 that the Griswold Supreme Court decision actually finally legalized birth control for married couples in America, okay? I'm glad we're not facing the Griswold decision with this Supreme Court. I got to be honest. But from where Margaret began 96 years ago, fast forward today, where Planned Parenthood is, 1 in 5 women in America come to Planned Parenthood at some point in their lifetime for health care. 3 million patients come to our centers every single year, as has been mentioned. And for so many women now, actually, a family planning center like Planned Parenthood, that's the only doctor visit they'll get all year because so many women put off their health care, right? So increasingly, they come for birth control, but then they'll also get their breast cancer screening or their cervical cancer screening or an STD test if they need it, or prenatal. Some women come now for prenatal care as well. But over the last years, but certainly this last year, we've seen an unrelenting attack on women and young people being able to go to Planned Parenthood for basic preventive care. Again, and we can talk about in the question and answer all the political battles that have been fought over the last year. But what I'd like to really focus on for a few minutes here in my remarks is that at this moment in which politics seems to be increasingly used to limit access to sex education, to basic information for young people, and reproductive health care, I actually believe that there is a huge opportunity on the horizon, and that is through technology. And I think that technology is a way, I hope, above and around and beyond a lot of the political barriers that are being put up to women and young people in being access to care, because there is a revolution underway in this country about how people access information and health care, and nowhere more than the area of reproductive health care. That's always been our goal at Planned Parenthood, again, ever since Margaret started, was to reduce the barriers to get access to reproductive health care information and services. And so again, I think using technology in a new way it's like the latest iteration. Now, of course, healthcare barriers in this country are difficult. I mean, depending on who you are and where you are. In every kind of reproductive and sexual health, as in all aspects of healthcare, people face barriers because of their economics, their background, where they live, their race, their language, their geography. But in the United States, seeking out reproductive health care services has a whole nother layer of barriers, whether it's getting access to safe abortion services or birth control or STD testing. The additional barriers are the social stigmatization that often come with just getting basic access and answers about health care needs, and it limits too many people from getting the care that they need. So this is my dream, is to give you a glimpse of the future where I believe actually we can deliver information and education and healthcare in a digital and social age, and it's critical that we do so. So to level set this, and I think it was alluded to already, 5 years ago, when I came to Planned Parenthood, we started PlannedParenthood.org. Literally, we had no one universal website. And it was a place to get information about birth control, whatever else you needed to know from Planned Parenthood. And this was a classic case of sort of, if you build it, they will come. The minute we were able to kind of get ourselves together and get organized, and every new addition to this site generated more and more traffic. I mean, we finally were able to put up so that you could actually type your zip code and find a Planned Parenthood health center anywhere in America. We became like the Fandango of reproductive health care in this country. Then we launched this widget so that folks could actually take a questionnaire about what kind of birth control might work for them, like a very simple 12-step questionnaire, and women filled it out everywhere because it helped them either whether they're coming to Planned Parenthood or their other doctor to say, hey, I've heard about this other kind of birth control, maybe I should check it out. Another one that helps you figure out if you need an STD test, if you might be at risk for a sexually transmitted disease, or another one if emergency contraception is something you should get. And so although 3 million patients came through our health center doors last year for hands-on, what I think of as hands-on care, last month in February, more than 4 million people came to us online in 1 month alone. For access to information that they might not be able to get anywhere else. And last year we moved things to mobile phones. And so in 2012, this year, we estimate we'll see 40 million people online, and half of them will be through their cell phone, okay? I don't know about any of you, some of you look like you might have kids, I've got kids. If it's not on their cell phone, it does not exist in the world. And so it is absolutely transformative to begin to provide access to information at Planned Parenthood through their cell phone. Over the last couple of years, I feel like Planned Parenthood has just been this sort of like living digital laboratory where we have found and we're able to track what it is that's on people's minds, what do they need, and particularly young people, how they look for it. And so we started piloting really innovative programs to try to, again, reduce the barriers for young people in this country, this whole new generation coming in, to get access to care and services and try to eliminate some of the barriers that we have in a bricks and mortar world. Because it's important, we have to do this. One of the things that, and I know a lot of you work in public health, despite all the things that we've been able to do in this country, I mean, we're at the forefront of so many things. Heck, we invented the iPad, which has revolutionized the world. We are one of the most backward countries when it comes to sexual and reproductive health care access. So the numbers speak for themselves. We have the highest unintended pregnancy rate of any other Western developed country. Teen pregnancy in this country is inexcusably high. On average, 730,000 teenagers will get pregnant every year. And the vast majority of these are unintended and undesired pregnancies. We know that being a teenage mom is a huge contributor to poverty later in life, not only for the mom, but for the children of a teenage mom. The children of unmarried teens have a 64% chance of growing up in poverty. Bless you. So these are really important issues. The other thing that's become, and there's a lot of conversation about this, is, and the CDC has been really focused on, is the rate of STDs among young people. So I don't want to depress you or make you feel like you got to pick up the phone and call your kids immediately, but this is pretty frightening. 15 to 24-year-olds account for nearly half of the 19 million new cases of STDs each year, okay? Now, they're not having half of the sex that's happening in the country, but they are getting half of the infections for STDs. And with most, bad health outcomes, it is disproportionately falling on young people of color and young people who have fewer economic options. So STDs and teen pregnancy, they take a huge toll. I actually was just asking, what does it cost this country? What does unintended pregnancy cost the taxpayers in this country? Depending on whether you, between the Guttmacher Institute and the Brookings Institute, it's $11 to $12 billion every single year. So it's not only a bad health outcome, it's a terrible drain on our nation's economy. But the thing that I think is heartening is that we actually know how to keep young people from being a statistic. There is work that we can do together to make a difference. Right now, millions of young people do not get birth control information before the first time they have sex, right? Even though 80% of parents say that they talk to their children about sex, when you ask teens, they say their parents never talk to them about sex. So go back and have a conversation with your child tonight. And getting sex education in the classrooms can be exhausting and politically very, very challenging. I don't know if you saw, I was actually in Utah last week, and the governor, and with enormous pressure, the governor vetoed a bill that would have eliminated any kind of contraceptive information for kids in Utah. But that was a major pitched battle. And in my own home state of Texas, where we like to lead the country in things like teen pregnancy, unintended pregnancy, uninsured people, you name it, we only have abstinence-only education. So see how that's working for us in Texas. And Legislatures in other states are making it a lot harder for folks to get for young people to get sex education, even though everyone in America supports sex education. This is one of the most universally supported, regardless of religion or background or anything else. Wisconsin's on the verge of repealing the mandate they have for comprehensive sex education. Other states are doing the same. So we've got to figure out ways to get sex education to young people without having to get it through the legislature, through the school board, through all the barriers that exist. And that's where technology comes in. So this is not going to surprise you. 13 to 29-year-olds spend an average of 7.5 hours a day in front of a screen, okay? I don't know what else they're doing, but basically, if that's my son, the rest of it he's sleeping. And usually it's multiple screens, and often at the same time. I don't know if you try to talk to your kids at dinner, where they're like looking at the TV, under the table, they're texting. It's just, there's a lot of competition, and that's where young people are. 4 out of 5 teenagers have a cell phone, and by the end of this year, half of teens aged 13 to 17 are going to have a smartphone, right? So they have access to everything. This may not surprise you, but 87% of teenagers sleep with their cell phone right next to their head, okay? So we'll find out later what all the medical issues are related to that, but literally so they can hear texts as they are coming in during the night, right? Okay, how many of you do that too, right? Okay, I do as well. And then the average teen, I think this number is low, but the average teen sends 3,400 texts a month, right? So this is something that they are living with every single moment of their life. It used to say that the car was that was a sign of freedom for young people, is to be able to get their driver's license and get a car. Now it's getting a smartphone. It literally is what transforms their lives. And the good news is, I think, it's actually bridging the digital divide, which existed when most information you got was through a static, either a laptop or a stationary computer, because African American and Latino teenagers are 50% more likely to use their phones to access the internet than other teens. So it's literally erasing some divides that we had. They live online. They're not just going and visiting websites. They're talking all the time, and they're having social conversations. And they are looking for information about sex and reproductive health care. Newsflash. About a half of really young people, 12 to 17 years, use the internet to search for health-related information. And a lot of it is information that's sensitive, that they may be embarrassed to talk about with anyone. The top 3 things that they search for information about: drug use, sexual health, and depression, right? So you can see now why this is so important that we get this right. In short, they're looking for information that they may not want to talk to their parent about, they may not want to talk to their teacher about, and so they're going places like Yahoo and getting information. And too often what they found is inaccurate. I just read this one the other day. This is on answer.com. Someone asked, "Can I use a plastic glove instead of a condom?" I mean, I don't even want to think about that. But the website tagged this as the best answer. "Well, one time my brother used one and the girl didn't get pregnant." So that's, it used to be that you just got bad information at a slumber party, right? Or, on the school bus. Now you get it online. And so the need and the demand to sort of get in this space is critical. So to reduce teen pregnancy, reduce STD rates, and get young people healthy information that we need to be aggressively in the social online space. So we've been piloting some innovating things. For example, we're using Facebook and Twitter now to literally get into these conversations. We started Hey PP, which is, it feeds focused on teens, questions that we know they ask because they come to us all the time, and PP FAQ, frequently asked questions for young adults, and we're developing a presence on Tumblr and other teen sites where they are there having these conversations already. We're also working with bloggers that focus on parents, because what the other single biggest demand we have for sex education is from parents who say, "I have no idea how to deal with the explosion of information that my kids are faced with, and yet not able to have a real honest heart-to-heart about sex education." This is one of the single biggest things that parents are talking about on blogs. But there's 3 concrete areas that we've invested in that I just want to mention because I think they're encouraging and they show that we can actually make an impact. And the first is texting. So the days of the 1-800 number is going away, right? it's being replaced by text and chat. So we've been piloting a texting and chatting program in 3 communities in this country, allowing young people to get in touch with a Planned Parenthood person anytime about anything that's on their mind. And over the last year, we've talked to, as I say, 65,000 folks, mainly young people. So, and we advertise through TV shows that they watch, through partnering with MTV's 16 and Pregnant. Really interesting. MTV said to us, you know, we run these shows, but we don't know a lot about what to say to young people who are concerned about getting pregnant before they're ready to have a child. And so it's being able to advertise and work with and partner with media entities like that. Our first year evaluation shows enormous success. And it's like the immediacy of what people can get. So the conversations are incredible. I'm just going to give you one that we got a text from a young woman last week. She texts, I mean, again, it's not even like, hi, my name is Jane. It's just they get right to the point. I'm afraid I might be pregnant, she texts. So we told her and so we had this conversation with you. Well, why do you think you're pregnant? Well, she had unprotected sex the night before. So we said, well, if you don't want to be pregnant, you can still take emergency contraception or the morning after pill, the vernacular. And there was a slight delay, and then she texts back, I can? And there was like exclamation points and, you know, going like this. You could actually like feel the relief through the text, right? This is suddenly, she's in crisis. She's terrified that she's pregnant. She probably didn't mean to have sex. She's not on birth control, and now someone on the other end of a text is telling her, you know what, your life may not end. It may not be over. And so, again, and then we're able to help her get an appointment at a local Planned Parenthood, do the follow-up so she could get emergency contraception right away. These are the same questions that we used to have in gym class, right? And now there's a way through text and chat to get answers immediately and to avoid an unintended pregnancy and to help people in their moment of need. And we're finding, too, a lot of things kids don't want to even say the words out loud. I mean, how many days might she have waited to actually pick up the phone and talk to her nurse and admit that she might be pregnant? We're learning a ton from these programs. They follow a pattern. They ask on text and chat exactly the same things that you would imagine they're asking. Like, I heard I couldn't get pregnant the first time. That's the question you hope people are asking before the first time. You know, can you get pregnant if you're if you're still on birth control? Can you get birth control without your parents knowing? A huge issue for young people. Some are quick answers, some are more complicated, but the most exciting thing is we're able to get in at the moment of need, regardless of where young people live and regardless of their situation. I think it's the single most promising real-time technology that sort of takes away barriers. And again, these are for kids in Texas who may have absolutely no one to talk, not to keep picking on Texas, but it's just, I think it really, and fairly soon will be the biggest program of its kind in the United States. Another way to reach people is telemedicine. I know this is something that's has already been invented in the world, but we're now actually seeing application for reproductive health care. I think you know this. I mean, more than 50 medical specialties already use telemedicine to connect people with expertise. University of Virginia is now using telemedicine for prenatal care, for high-risk patients, you know, being able to video conference their local care providers and get state-of-the-art testing and treatment. VA, of course, has been pioneering this forever to try to help the veterans in rural areas go to local clinics, but where they can actually video conference with a doctor. So we've been experimenting and beginning to pilot with this as well across the country. So patients come into our health center and meet with a health assistant or a nurse, and then with a doctor, they can join by video conference in real time and interact about birth control, about most of them are about birth control, also about STD testing. The provider on the video conference can walk through pulling the blood sample or taking the swab, talk the patients through the testing, what the results will be. And we're also exploring how to plug Planned Parenthood into networks of specialists who provide kinds of care that we can't deliver in our health center. and vice versa, making sure that we can partner with others so that our expertise, which is reproductive health care, we can partner with others through video conferencing and telemedicine to other healthcare providers for whom this is not their specialty. And the last area where I think there's just huge opportunity is sex education. Now, again, I told you I was born in Waco. I grew up in Texas. My sex educator was a coach, and he was a great guy. He was not particularly comfortable talking about women's reproductive organs. And he did the best job he could, but we could do better in this country. And traditionally, sex education has taken place in schools because that's where we could reach a lot of young people. But I think that what you know is increasingly, as I said earlier, there's too many states where they're banning sex education. Sometimes all it takes is one parent, and sex education goes away. Even now, only 21 states really require sex education. 21 states. And of course, it's the states that don't require it that often have the highest teen pregnancy rates and STD rates. 2 weeks ago, there was yet another study. So just to remind any of you who don't spend your life thinking about sex education, there was yet another study in a long line of studies that show sex education actually helps young people change their behavior. It helps them delay the first time they have sex, and it also it helps ensure a greater likelihood that they will actually use protection when they do decide to become sexually active. So we know it works. The problem is we're not in enough classrooms. But if I look at the number of people we see online now, basically each month it's equivalent to about 160,000 classrooms in America, right? So just do the math. This year, more like 1.9 classrooms in a year. And so it's an enormous opportunity to get young people the information they need the way they get it. So we're creating digital sex education based on science of behavior change. One of the key elements for young people is norms, and a lot of you who study behavioral science, one of the most important ways for young people to delay becoming sexually active is to kids have sex because they think everyone else is having sex, right? I mean, everyone wants to they want to be like everybody else. So we're getting key messages out that we know actually change that behavior, which is when you teach a young person that on average, people start having sex at age 17, that's the single most important piece of information you can give a young person that will help them then delay their own onset of sexual activity. The second most important thing they can learn is that 80% of young men use a condom when they have sex. That completely increases condom use, and that's how we can get to the other 20%. You might wonder, do these health kind of interventions work? They absolutely work. And I mean, we've seen it repeatedly in all kinds of things: mental health, smoking cessation, but only a few in the area of sexual and reproductive health care. So there's enormous opportunity ahead. We are creating the largest intervention related to sexual and reproductive health ever, based on both science and what we know that people like to do online, particularly young people, particularly my son, like play games and watch videos and fill out quizzes and share things, right? So imagine being able to share a really cool video about bringing up with a new partner that you want to use a condom, that it's really important to use a condom. Or having the question you pose in Yahoo answered by someone who actually knows what they're talking about. That is really exciting. And again, I think that there's an opportunity here to use videos, and we've already seen it, beyond having ones of cats playing the piano and stuff like that, which is great, but they're ones where we actually can change, because young people are looking for this information. This is what I say to some of my friends. It's like, the thing about Planned Parenthood is we don't have to create a demand. It's already there. I don't have to convince young people about global warming. I don't have to convince people about that there's poverty. Young people are interested in what we do, and they're looking for this information, and we have to be there for them. So it looks different than when Margaret Sanger started this work 96 years ago, but it's actually kind of the same thing. We have the ability now, obviously, to reach millions more young people with honest information in real time through a means that they have with them 24 hours a day. And I think the real struggle, so you say, okay, so what's the big problem? Why can't we just do this? The single biggest struggle is dealing with the politics of it all. Right, is the barriers that politics are putting ahead of the well-being of young people in this country and of women. Because I feel like every time we make 2 steps forward and then there's another step backward. Partisan politics, rather than public health interest, is driving reproductive health care policy in America. In the bricks and mortar world, in the last couple of years, we have faced enormous challenges by Congress and by others trying to prevent not just access to safe and legal abortion. We are now fighting in this country about whether women should have access to birth control. And my friends, we are not going to go back to those days. We are seeing attacks on access to family planning, access to breast cancer screenings, access to pap smears. We talked about this a little bit earlier with one of the classes, but I think it's important to remember that the vote that the U.S. House of Representatives took a year ago to end Planned Parenthood services in this country had nothing to do with abortion. Abortion in this country, federal funding for abortion ended decades ago under the Hyde Amendment. And personally, I think it's wrong, and I think low-income women in this country have suffered for decades as a result of that bad law. No, but the attacks that were made in this Congress were about ending all the preventive care that we do. Birth control to 2.2 million people every year, more than 4 million tests and treatments for STDs, 730,000 breast exams, and more than that of pap smears each year. That was literally what was at stake, and that's what the House voted to do. So we are now literally fighting for the right to get preventive care in this country. And I mean, it's an obvious point, but you'd think, if you really wanted to reduce the need for abortion in this country, wouldn't you come volunteer at a Planned Parenthood health center? Because we do more every single day to prevent unintended pregnancy and the need for abortion than all these people carrying these picket signs will do in a lifetime, right? Last year, a lot of states passed laws that really target regulations at reproductive health care clinics. Virginia, a very egregious law, making it much more difficult for clinics to stay open. We're also seeing a whole slew of new bills aimed really at nothing more than humiliating women. In Texas, again, I hate to keep returning to the scene of the crime, but Texas actually has passed and now implemented the required vaginal ultrasound bill, right? So that now women in the state of Texas, regardless of what point they are in their pregnancy, have to have a forced vaginal ultrasound the day before any procedure. We're facing 24-hour waiting periods. All kinds of procedures that aren't medically necessary, but that are required by lawmakers, who, by the way, are not physicians and are not medical providers. I think most of us believe in this country that healthcare shouldn't be politicized, and it certainly doesn't come with a political label. And I want to just say, I just left Arizona, where I'm very proud that, actually, you know what? We just voted down the birth control ban in Arizona, just not too long ago. I literally just got it on my text, so good things can happen. But Arizona, Planned Parenthood was started by Peggy Goldwater, Barry Goldwater's wife, right? We have hundreds of thousands of Republican supporters. Planned Parenthood is the ultimate big tent. We are Republicans, we are independents, we are Democrats, because we believe that women's health care does not come with a political label. All the same tools that we are using to expand information and access to health care that we talked about, we're also used to advocate and I hope to organize against some of these efforts. And in the last year, I feel like we have seen what young people around the globe can do in the face of censorship, and what our supporters can do when Planned Parenthood is under attack. This is the other power of technology. It's the power to connect people, the power to tell our stories, to get our message out, and to drive social change. In the last year, more than 1 million brand new people joined Planned Parenthood as activists, and half of them were young people, because they saw their very access to health care under attack. When the House of Representatives voted to end all federal support, young people got mobilized like never before. But that was just the beginning. And it was alluded to, and the Komen Foundation announced they were severing their relationship with Planned Parenthood. More than 1.3 million tweets which is what you do on Twitter, okay? 1.3 million tweets were sent in the space of 3 days and drove mainstream media coverage that changed that story completely. When the Virginia legislature was trying to pass the same bill that Texas did on the vaginal ultrasound, I don't know if you remember seeing the stories, but through Facebook, women and young people mobilized and literally, physically made a human chain around the Capitol and walked that back. And when, again, oh my gosh, why does he keep coming back? Texas Governor Rick Perry. But when he ended the state family planning program in Texas, thousands of people rallied across the state in small towns and in big cities. And they learned about it through social media, through Facebook, and through Twitter. So I think at a moment in which it feels like there are some folks in this country who want to take us back to the 1950s, I actually take comfort in this fact, that 96 years ago, Margaret Sanger was arrested for distributing information about birth control, literally just pamphlets about birth control. But this coming year, more than 40 million people will have access to that information through our website. So you got to say that's a little bit of progress. Oh dear, I broke your microphone. Sorry, I hope that works. So it's not everything, but you have to take hope in the opportunities for the future, right? Because otherwise you get just too darn discouraged. I think there's enormous potential, not only for Planned Parenthood, but for everyone who believes that access to reproductive health care, information, and services should be available to everyone because it can change people's lives. So technology itself isn't going to change the world, but I think all of us can together. Thanks so much for being here today. I appreciate it. That's okay. I don't know whose that is, but anyway, I guess I'll come fix it if they want to.
That was absolutely terrific, so thank you so much.
Absolutely.
So it's time for some questions, and I guess I can take the prerogative as the chair to ask my own question first while we're waiting for some people to come down. So I think it's fascinating that you have all of these different ways of reaching people now, and I thought if you could expand one thing, what would it be that you would pick out of your initiatives?
I think, it would absolutely, well, speaking of this, I'm not sure of these, it would absolutely be text and chat, because I read all of the interactions we have, and, it's kind of funny. One of the real blessings of this work is I get to meet people all across the country, and I will, it's like every week someone will come up to me and say, Planned Parenthood changed my life. And I don't know if any of you went to Planned Parenthood, but if you did, I would imagine you can tell me exactly, you can put yourself back in that day exactly. No one ever forgets, because it's usually a time in which you're anxious, you may be embarrassed, you might be afraid, you don't really know, you don't know what questions to ask, and Planned Parenthood was there, and that's what I see in these texts, is young people who are, like the young woman I read her story, who are so relieved that there's someone on the other end of the wire, or whatever it is, I don't know how it works, that can be there in their moment of crisis, and you can literally feel the relief through the phone, even if the answer is a tough one. Even if it's a tough situation. That to me is like the single most important thing we could be doing.
Okay.
Hi, thank you, Ms. Richards, for your talk and the very important work you do. So I have a question relating, you touched briefly on all this legislative backlash that we're currently seeing regarding reproductive rights and health. And I'm wondering whether Planned Parenthood has kind of like a long-term vision plan action in terms of rolling things back? Because, as you say, like technology is extremely important in getting information out there. But then my next thought is, well, there's all this censorship that's still happening, and in some schools you can't access information, or in public libraries. So I'm wondering what the plan of action is in terms of helping roll back these laws.
Right. So I think, well, one thing, the great thing, and I probably didn't do as eloquent a job as I should have, but I think the great thing is, I mean, it did used to be you had to go to a public library to go, now you just basically have a cell phone, and you can kind of get and that's where I think we're moving to. So I feel like it's like literally in the hands of people to get information that that historically found very difficult to get. I'm going to put it back on you, because my hope is your generation. There are a lot of things that give me hope. I've been an organizer all my life, so I'm sort of like a perennial optimist despite all the incoming information. And I have seen in this last year young people get organized and take on these issues in a way that I have never seen. I haven't seen in decades. And it's not just young women, it's young men. The fastest growing population coming to Planned Parenthood now are young men who are coming for health care, or they're coming with their partner. And so they are taking on these issues as well, and that's a great sign, right? It's because these are issues of human rights. They're not issues of simply one gender or another. So I think the most exciting thing, and I'm an old-fashioned organizer, is like, I just want to know, like, how many people can you bring, right? Who's going to actually, at the end of the day, stand up and make a difference? Although I will tell you, it was interesting, in the Affordable Care Act yesterday, the supporters of the Affordable Care Act outnumbered the opponents in front of the Supreme Court 5-1, right? So that was not, and a lot of them were young people who got active with Planned Parenthood or women's health care issues over the last year. So I just think there has never been a better opportunity, and there's never been a greater need to stand up for your generation and to demand your right to access to health care information and to health care services that will help you live your life. So that's my charge to you. Okay? You up for it? Okay, all right.
Hi, my name is Allie, and I actually had the privilege of working in the South Austin clinic at the Central Texas affiliate as a reproductive health specialist. Yes.
Wow, nice to see you.
So happy that you're here.
You will do amazing work there.
Oh, it's a great clinic.
Yes.
It's fantastic. I was privileged to work there. I wanted to ask your opinion on this new legislative trend of seeing legislators introducing bills addressing men's health, like the prostate exam to get Viagra and things like that. I mean, obviously, they're couched in humorous terms and the ridiculousness of it all. Do you think it's a successful tactic?
Well, I think it's great to try to actually call these bills for what they are, because most of the bills that are being passed, limiting women's access to health care, underlying them is a fundamental tenet that women are incapable of making responsible decisions without the legislature intervening in their personal lives. And that is just absolutely unacceptable. So I love the thought that actually we are going to then equal the playing field and say if women are incapable of making medical decisions, then men must be as well. And then just try it on and see how it fits. I think, and I do think social media has played a great role in this. I'll just use an example, which I know probably all of you saw. But when the hearings were held by Darrell Issa on Capitol Hill, actually a Planned Parenthood a gentleman who works for us, Oliver Kim, went to the Hill and was sitting there at the hearing, and he looks up, and here are 5 men about to explain why women don't need birth control. And so took a picture on his cell phone, sent it back to the office, it got posted, and the rest became sort of viral history. So I think it is really, the thing I love about this opportunity now is that people can, through social media, tell their stories, and they can expose what I think has been a lot of hypocrisy around the treatment of women and women's healthcare issues. Now we have the means to do it, and we just need to be using it. It's absolutely, I think, transformative. But thanks for what you do, and thanks for the work that you. Texas is one of the most challenging places now. They have closed. We've closed some Planned Parenthood health centers in the Rio Grande border. because they ended the family planning service, support in that state. So it's a sad day. Thanks.
Hi, I just wanted to say thank you so much for what you do, and it's a real honor to have you here. I actually, just learning about the leadership responsibilities you've held over the course of your career and that you continue to hold, it's incredible. And I was actually wondering if you have any tips for young people on how to manage your time if you want to continue to lead in this capacity and fight for these fights.
How to manage your time, and what was the second part? Sorry, because we were all like, yeah.
How to maintain the energy to lead on these issues and fight for them even when it's such a struggle sometimes.
Well, I have no idea about time management. I think that's and once you have kids, it becomes even more complicated. But I guess the only thing I would say to you, and I know some of us talked earlier in some of the classes, I have been unbelievably blessed in my life to get to do work that was meaningful to me and make a career of it. And so I guess all of you young people who are starting out and thinking about public health or working in nonprofits or whatever else, if you can find something that you're passionate about and you can do that for your job, I just can't tell you how great your life will be. And it doesn't, look, I could do this, and I do, all day and into the night. There's nothing more energizing to me than getting to do the work that I do at Planned Parenthood, to organize more people and young people and interact with them and learn from them. So that's my only advice. You'll never be able to manage your time, so just find something that you like to spend time doing, and it won't seem, it won't matter, and you can do it. You can do it. Yeah, good luck to you.
Hi, thank you so much for coming and spending a couple days with us. One of the wonderful things about the Woodrow Wilson School is all of the international students who are here. Mm-hmm. And in talking both today and also just in the past year with our international classmates, most of them have been shocked at the political turn of events in the United States. And I was wondering if Planned Parenthood is looking to international models at all, or if there are anything that other countries are doing or not doing in terms of politicizing these issues that Planned Parenthood is looking at to get ideas of other ways to move forward.
Well, first, let me join the international students in saying I too am shocked at the political direction of on these issues. I mean, particularly the issues of women's health. And I also would invite anyone from any foreign country who has any suggestions about how to get out of this fix that we're in. I'm more than open to suggestion. I do think that there's going to be a point in which folks say enough is enough, and I hope we're getting to that point. I actually think in an interesting way, and it's not the way I would have liked it to, it wouldn't have been the forum in which I would have liked it to happen. I feel like it kind of happened in the Komen situation when, again, our fight was not with the Komen Foundation, because we share the same goal, which is we want women to get early detection of breast cancer and early screenings and education that can help them self-detect breast cancer. It was the folks that were out there trying to demonize Planned Parenthood and drive a wedge between Planned Parenthood and Komen. That was the real problem. And I think what we saw in that example is when American people said, okay, that's too far, right? That's too much. We're not going to play politics with breast cancer screenings in America. And that is literally why in 3 days that turned around. So I just feel like we've got to speak up more and got to talk about the fact that the issues that we are dealing with, these are healthcare issues. The only person who would call birth control a social issue is someone who's never used it, right? The average woman in America, 99% of women in this country, if they're ever sexually active, use birth control at some point, and 98% of Catholic women, right? So this is normative. This isn't like a strange social phenomena. The Guttmacher Institute, my favorite statistic is that the average woman in America plans to have 2.3 children, or something along those lines. I guess 2 or 3 or something in between. And she spends 5 years having children, getting pregnant and having children. The average woman spends 30 years trying to avoid being pregnant when she doesn't want to be, okay? That's a lot of birth control in this country. That's not a social issue. That is a major public health issue in this country, and we should do everything we can to help women get birth control when they need it. Off the soapbox, okay. I'm getting the cut sign, okay.
Thank you for coming and giving this talk, and thank you for your work. One of the things that has shocked me the most about the recent presidential campaign was that even though it was supposed to be so much about the election, this contraception issue kept floating up. Yes. And, you know, with some of the things that you mentioned, 99% of women use birth control, 98% of Catholic women use birth control. It doesn't even seem to be good politics. So my question to you is, why is this issue continually resurging and floating up despite its political inviability?
Okay, you're really smart, and I couldn't agree with you more. So maybe you could talk to them. I mean, look, I think that I think there's a couple of things happen. First, I'm going to just take an opportunity to kind of, a little opening you gave me there. It's the 2010 election. I don't know if you all remember the 2010 election when everything got realigned in this country. Birth control, abortion wasn't mentioned at all, right? That was an election about people who were concerned about the economic decline, about unemployment, about home foreclosures. The new Congress, when they got in, did they start dealing with those issues? No. Do we have a jobs bill? No. The first thing they did was went after Planned Parenthood and ending the National Family Planning Program. Okay? So we've been on this roller coaster now for about a year, and it's not what the voters voted for, and it's not what the voters wanted. And in fact, in this, you know, I don't like to be that competitive, but after this entire, you know, back and forth we did with Congress over defunding Planned Parenthood's approval rating went up. 69% of people in this country approve of Planned Parenthood, and 10% approve of Congress. Okay? So to your point, I don't think it makes political sense. The concern that I've had, and obviously I think all of us had, of watching this Republican presidential debate, it has literally been a race to the bottom. It is like everyone's trying to, every debate is like they're trying to outdo themselves. Like, no, I would be worse for women's health. No, I would be. No, I would be. And then getting into birth control, you know. So I actually think, unfortunately, and I say this because we have a lot of Republican supporters who are very discouraged about the turn of events, this Republican presidential primary has been a fight for the hearts and minds of a very small segment of the United States public. And that is an enormous disservice, both to what I think of as traditional conservative Republicans who believe that government should be small and not in your personal business. And it is rewarding folks who are trying to hold this party hostage to a very extreme agenda around women's health. I don't know what the end result will be. I do think women are upset, and I do think that one thing to remember is that women will be the majority of voters in November, if past is prologue. 53% of the voters in the 2008 elections were women, and that will probably be what it is in 2012. I actually believe, and I'm sorry, I know there's a lot of men in this room, and I'm really grateful that you're here, and you're going to be important too, but women and young people are probably going to determine who the next president is of the United States. So it's kind of in your hands whether this country on these issues moves forward or whether we go back to the days of Mad Men and no one being able to get access to birth control. But I don't think it makes political sense.
So we have a question.
Yes.
Thank you. Thanks for
welcome.
your time, Ms. Richards.
So glad you're here.
My question is pretty simple, actually. One of the most common arguments I hear against Planned Parenthood, and specifically sort of preventive and informational services, is that they encourage irresponsible behavior amongst kids. And frankly, I hear the argument from my peers at Princeton all the time, and I sometimes struggle to respond to it because it's a sort of very principled argument, and I don't know that much about the facts of how true that is. So I was just wondering what your take is on if that's true or sort of...
So, excuse me. Sorry about this. So I think there's a couple parts of it. One is, I think, and I mentioned it earlier, and there's just like studies, like for years, that providing young people information about birth control, so I'm going to do the sex ed part first, right? Actually, the more young people know about sex education, that they know about birth control, they know about contraception, they know about STDs, they know about prevention, the less likely they are to engage in sex before they're ready, and the more likely when they do become sexually active, because they will at some point in their lifetime, chances are. I mean, that's what I think we forget, is that you may teach kids in high school, I don't care, that doesn't mean they're going to have sex in high school, but at some point they're going to, right? And we need to teach them how to get birth control. The more likely they are to use protection, to use a condom, to use birth control. As far as your other, I mean, I think part of your question is that I don't have to talk about sex for young people to think about it. And I don't want to be, I'm not trying to be funny about it, is sex is everywhere, except when it comes to providing real information and honest conversation. And so, I mean, I think of my own kids who grew up watching Gossip Girl, you know, One Tree Hill. Let's just go down the list. Sex is everywhere. It's in music, it's on the movies, it's on the television, and yet somehow we don't want to teach sex education or provide access to good information. So the cat's out of the bag, you know, and I think that the most important thing we can do, and we take this very seriously at Planned Parenthood, when young people come to Planned Parenthood and young people text us, often what they want to know is, am I normal? Is it weird to be a virgin? You know, are other people having sex? This is the way I'm feeling. And they're coming to us because they need someone to talk to. And our goal is to help young people delay having sex before they're ready, and to make sure that when they do make that decision to become sexually active, that they use protection and they use contraception. That's our whole goal. So, good luck. And thanks for the question. It was a really good question.
Hi, I wanted to thank you once again for coming, and I also wanted to...
you all are the politest students I've ever found in the country. So, no. Really.
You're also hilarious, and I really appreciate that. It gets me through my day. Definitely a highlight of my Wednesday, yes. So thank you for that as well. I wanted to bring the conversation back to what you mentioned with women and young people being the highest percentage of voters in the past election, and most likely will be in the 2012 election as well. And the reason why I wanted to bring the conversation to that was because there are politicians and other people making these decisions for women, and I wanted to ask you, yes, on behalf of your organization, if you have a message or you'd like to create a message for these women, because although this does have a lot to do with their personal concerns, you see them backing and supporting different politicians or pieces of legislation that would otherwise harm them, regardless of whether or not they're in this party or that party. So is there something that should be done? Is that like a lack of access to information, or what really needs to happen? What message needs to be out there to say, hey, this is important not just for yourself, but, you know, I mean, I don't know.
Yep. No, it's a great question. So I'm going to kind of put on another hat here, which is I'm not only the president of Planned Parenthood, I'm also president of the Planned Parenthood Action Fund, which is the organization through which we do our advocacy, endorse candidates, work in elections. And one of the things we did this year was launched a website called Women Are Watching, and it was an opportunity to start posting things that candidates are saying that relate to women's healthcare access, because it's very hard to follow the ball, right? There's so much going on. So it's really important to us that women and men know the candidates' positions, certainly that are running for president, but also that are running for office all across the country. And that's one of the things that we hope to be able to provide. You know, one of the things we found in the past elections is that, and this is kind of true about women in general, they're pretty skeptical of politicians. Shocking. And they don't, you know, so they discount a lot of the information they hear at election time, but they really trust Planned Parenthood because they feel like we're an honest broker when it comes to women's health care issues. And so I think that it's important for us to, again, in a totally nonpartisan way, just say, hey, here's what these candidates are saying and what they're committing to on women's health care issues. And listen, I keep thinking I've seen it all. I've never seen an election like this where literally issues of access to birth control may be determinative in the presidential election. It's kind of crazy. Yeah, it's kind of crazy. So, yeah.
Not to be redundant, but thank you again for coming.
That's okay. No, I know. I feel like you guys must get taught when you're freshmen, like you always are thank people anyway. But that's really nice. It's my honor to be here.
So my question is, it's surprising. So you've talked a lot about the breadth of services that Planned Parenthood provides, but a lot of times when you mention Planned Parenthood to people, the first thought is still abortions. Mm-hmm. And I guess that was most clear when I think John Kyle said over 90% of what Planned Parenthood does, like, he didn't think anyone would check that statistic. But I'm just wondering, how do we change? It seems like the image of women's health is still abortion, and how do you sort of change that to talk about what seem to be much more important issues?
What a perfect opening to tell a couple of stories. I think that's right. And again, I think that I want to be really clear that it is really important in this country that abortion is legal and it is safe and that women can get access to it. And there's too many places around the world that women die, and they did in this country as well before abortion was legal. So it's part of women's health care. But it's not all of women's health care. And as you mentioned, for Planned Parenthood, more than 90% of our services are preventive care. And if we could do more preventive care, obviously, we could have fewer unintended pregnancies in the first place. But we just have to continue to tell the story. And part of it is through our opportunities that were provided, for example, during the congressional debate, and part of it is by having our patients be the face of Planned Parenthood, and we've tried to work on that this year. So 2 examples, I think. One was, of course, that was an interesting moment, because it is sometimes our opponents who they give us a little bit of an opening. So when Senator Kyle said that about 90% of our services were abortion, and then, of course, it kind of got called on it, and they put the press spokesperson out there to say, well, actually, it wasn't intended to be a factual statement. And then Stephen Colbert just had a heyday with that. He went on, but it wasn't the only moment. And then it was great because then we were actually, this is what we do. And I remember actually, I was on TV that night and had the opportunity to say what we did, the array of services we provided. But another one was great when, I don't know if you remember this, but at some point the Fox newscasters went on and said, well, this was during the big debate over whether Planned Parenthood should exist. They said, well, women didn't need Planned Parenthood. They could go to Walgreens for their preventive care like Pap smears and, like that. And so Walgreens immediately puts out a statement saying, no, my gosh, women, don't come to us for Pap smears. No. But then, of course, that evening, Stephen Colbert goes on, because he just can't let it go. And he goes on that night to say, yes, women, go to Walgreens. You can get your Pap smear. Just look for the stirrups in between the kitty litter and the Swiffer refills. But again, that was a moment that provided us the opportunity to educate people about all the array of services that we do. So we just have to do more of that. In this last year, we've had thousands of patients tell their stories on Tumblr, on Facebook, in Congress. One woman, Carolyn Smithers from Florida, was a patient of ours in her 20s. That's where she got her first early detection of cervical cancer and was treated. Her 2 daughters in their 20s now are Planned Parenthood patients. She went to Congress, I think, 3 times and made a television ad. It was so really trying to put a face on who Planned Parenthood is. Actually, we have a book here. I don't know if I brought copies, but it was called Stories from Home. And it was, we got one story from all 50 states, put it in a book, and took it to members of the United States Senate so they could understand that there were women from every single state in this country who were writing in their stories. So we just have to continue to do that and help educate people about the entirety of what women's health care is in this country.
Hi, thanks for coming.
I know it's a game now we're playing.
I'm struck that the name of the organization is Planned Parenthood, yet we're only talking about one half of the parents, prospective parents. Mm-hmm. And so I'm wondering if you could talk about how you have any initiatives to bring the men into the picture, talk to them about their risks for STDs, talk about how they can inform their girlfriends or whatever, how they can inform their boyfriends.
Absolutely.
Can you talk about how you could bring young men in, so that they can grow up and be, better lawmakers?
Yes. I knew you had an ulterior motive there. I'm so glad you asked that, and I forget because we've had so many classes today that we didn't talk much about this. Men are not only the fastest growing population of coming to Planned Parenthood, again, either as partners or as patients themselves, but we do an enormous amount of education with young men, and a lot of young men who are already parents before they wanted to be parents, and training them as peer educators to work with other young men. I know we do some of this even here in New Jersey to help other young men, teach them what they need to know, everything from the negotiating skills to literally information about contraception, to help them, finish school if that's their goal, finish college if that's their goal, and not to become a parent before they're ready to take care of a family. So I actually feel like young men are a huge part of this and a growing part of our organization. I was just in Oregon with our national conference, and we have a huge young leadership training conference there. A third of the young activists and young peer educators are young men. And they are amazingly committed. And they come to these issues from a whole lot of different, sort of walks of life. Some of them come because of GLBT issues. Some of them come because, they're concerned about birth control and STDs, some from a social justice point of view. But I feel like that's actually, to me, if I look at the future, there's a couple of things I see. One is obviously, I've already given you my pitch about why I think technology can change the future. But the other is, if you look at this new generation in the United States of America, it's the most diverse ever in our history. It's so exciting. I mean, it's diverse ethnically, racially, sexual orientation, you name it. And that's, to me, who Planned Parenthood is, and that's the future we're focused on. And again, with gratitude for my mom and others who led the fight for women's rights back when they did, we can't let them down. But we got to bring a lot more people into these issues and understand that these are basic human rights issues. They're not just women's rights issue. So, and I'm glad to see so many men here tonight. I mean, let's hear it for the men that are here. And here's one right now.
Hi, thanks again for coming. So I was just wondering, in light of recent comments by Rush Limbaugh that everyone has heard about,
Yes.
calling a woman a slut and a prostitute for wanting contraception, even though it was in the context of ovarian cysts, and also possible amendments that would require, explaining the reasons why you need birth control to prevent cancer. So I guess my question is, what role do you think sex positivity should have in women's health? Is it acceptable to say we need, birth control to prevent cervical cancer or ovarian cancer? Or do you think that it's just as legitimate to say we need birth control because women have the same right to have sex as men do?
Hear, hear. Let's hear it for, No, I completely agree. And I just, look, everyone's having sex. Even members of Congress have sex. And so it's unbelievable that we cannot be honest about these conversations. And so this bill, which I just referred to, and I'm sorry I didn't explain it, but I was in Arizona 2 weeks ago. It's exactly what you're saying. They're going to pass a bill that says basically, I'm just going to use an example. If you're a 35-year-old woman, married, 2 kids, and you want to use birth control, and you want to get it covered by your employer through your insurance plan, you have to bring a doctor's permission slip to say that you're using it for something other than preventing an unintended pregnancy, as if somehow there are better reasons to use birth control. There are other good reasons, but it is absolutely ridiculous. This whole thought that women, I mean, it's just insane to me. So the good news is the Senate just voted that down in Arizona today, but it may be back. So yes, I think that it's right. We are sexual beings, right? That is part of who we are. And it is time that we just, again, it's just incredible to me that this country cannot come to grips with that. As we also know, it's oftentimes the folks who are the worst attackers who seem to have their own issues with sex. And yeah, I think we just, I think it's really important that we stand up for the right, for all people to have a sexually fulfilling life and to not to have children when they're not ready to have children. Everyone's using birth control. It's just crazy. It's just insane. I think the American people know it's insane too, right? I mean, I think you're seeing that every day. I know yeah.
This will have to be the last question.
Oh gosh, I'm trying to think of another funny story to tell you, but okay, go for it. I'm going to wrap it into whatever you ask me.
I'll try to make it a good one.
No, it's okay.
Thank you
No
very
pressure.
much for your talk. I'm one of those international students in the Woodrow Wilson School who has a very hard time trying to understand the politics around women's health in the U.S. I'm from Canada, so. And I was wondering about a lot of these state bills that are coming forward, and the strategy to respond to them seems to be, and especially sort of drawing on some Republicans and saying government doesn't have a place in women's health and in the private sphere. And if this is by sort of pushing women's health into the private sphere and saying that government shouldn't be intervening, if that's delegitimizing its place in the public space, and what this means for the long-term strategy by sort of trying to make it a private issue instead of saying this is legitimately a public issue and then bringing public funding into that.
Right. Well, I mean, I think, and actually it's really great to be here, and we've had some really interesting conversations today, because I do think part of what is at stake here is, do we believe that there should be a public health system in America? And I think women's health is just being used as sort of the lead dog in this conversation. But when you hear, so I think the question is, does the legislature, does a politician have the right or somehow better information than a woman's medical doctor to make decisions about her health care? And that's really what this fight is about. But I think the issue of whether we believe that public health is a good in and of itself is, I think, a fundamental thing that we've got to have to grapple with. And I'm just going to pick on Mitt Romney for 1 minute, because he brought it on himself. He said the other day that he said, well, we're going to get rid of Planned Parenthood. So, okay, whatever. Them's fighting words to me, but I think, but the other thing he says is, we just can't afford Planned Parenthood. We can't afford that in this country. Well, if he can't afford Planned Parenthood, I know he can't afford unplanned parenthood, right? Because we already know the billions of dollars that costs. But to me, that was much more a signal of saying, you know what? We simply can't afford to provide health care to people in this country anymore. The National Family Planning Program that Richard Nixon, by the way, signed into law, right? Bipartisan support for decades. This is what Mitt Romney has now committed, and every other candidate on the Republican side. They're going to end the entire National Family Planning Program that provides health care to 5 million women every single year. And that is a fundamental question, not only of women's health, but whether you believe that public health has any value in the United States of America. And that's what concerns me. And I do think that's what's going to be at issue. I guess I couldn't put a funny thing in that one, but it's such an interesting time. And for those of you who are looking at public health as a career or as a potential career, frankly, there's just never been a more important time. Public health is a good in this country, and we have to nourish it and value it. It's fascinating that we're here poised on the Supreme Court decision about the Affordable Care Act. I'm surprised we didn't talk about that, but that's okay, because I don't know. I don't know what's going to happen. But we have to get serious in this country about making sure that people have access to health care. And so I'm so grateful for what you do and grateful for this opportunity to be with you. It was really fun. Thanks a lot. Thanks a lot.